Well, hey everyone, thank you for having me here, and really excited to be part of the Teamworthy family. And so QuickSort basically helps hospitals manage their drug spend, find every opportunity to save tremendous amounts of money. But basically, I was a lifelong tech enthusiast. Got my first computer when I was 5 and released my first game to friends when I was 12, and I've just always loved computers and the sort of mystery about how they worked and eliminating all of that. So basically my whole life I was just trying to figure everything out, how everything worked, and was obsessed. So I come from a healthcare family. I thought it was kind of gross, but I ended up at, personally, but I ended up at a major health systems anyway, because it was the most complicated, largest system in town. And I love systems, and so I wanted to know how everything worked. I was a network architect for a while, and so I designed all their communication systems and was responsible for making sure that everything was kept running all the time. And so through that, I really became obsessed with customer service. How can I provide absolute best customer service to the people that work at the hospital? We serve the university, we serve the hospital. I ran the research and education network for the state of South Carolina as well. And so found myself with a lot of responsibility, which I really loved. And so, but then I didn't like getting calls, so I figured out how to automate almost all of my job, really, all the design, the network replacement. And to make my life really easy is sort of I call myself super lazy. Once I figure something out, I just want it to be automated and go away. And so that led to basically me having a lot of free time, causing a lot of problems at MUSC for a bit. But then I got the opportunity from the CIO to run an innovation team at MUSC. So it was the first innovation team, and they said, you've got to get out of the IT department. You can go into any part of the organization, but you can't go into IT, and you got to find something. And so I took that and ran with it. I found my co-founder, Matt Hebbard, who's a pharmacist, and so he was managing pharmacy purchases in a back room somewhere, and he couldn't make heads or tails of it. And so it looked like a very interesting problem for me. So we started working on it. I literally worked around the clock for over a year until we had any sort of breakthrough. But about a year later, we went live at MUSC with this new system, and within a couple months, it was saving more than my salary every week. And so for the first time, I hadn't really thought about commercializing something before, or I knew I didn't really want to do it. But then I got really excited about it, and I was like, I've got to do this, and we have to bring this to more health systems, because every hospital had this problem. And so basically, went through tech transfer, was able to get our first customer outside of MUSC. Once we were out on our own, it got a lot harder. The pandemic hit, and it took us quite a while to get any more customers. And so that was kind of a time in the wilderness. And so, but it really helped us refine our values. And so, being that I worked in the network team, I didn't want to build another enterprise software company like the ones I worked with. I just didn't really like most of them. And so we just sort of committed to building a different type of company and providing a different level of service. Took a while to convince folks, but then we finally brought on some great founders in Charleston that basically did a seed round with us, helped us hire our first salesperson. We knew we had a great product, but even if it prints money, it doesn't sell itself. So, but ever since then, as you can see, it's actually 38 health systems now. I need to update the slide. We've saved customers over $150 million in return to these community health systems, and we're now the top performer in our industry. We also hire PharmD supply chain experts to come in to help all of our customers. Basically, we want you to work with people just like you, and that's incredibly powerful. So they're not answering software tickets. They're like, hey, how do we go get this pile of money and make it happen? And then we're connecting everyone with a real strong community. So honestly, hospitals manage, some of our hospitals have billions in drug purchases a year. They've got contracts all over the place. They're buying thousands of products. The market's always changing. So there are always opportunity for them to reduce cost, or they need to adapt rapidly. Otherwise, they can't run at the level of efficiency they really need to run at today. We're expanding our portfolio. Basically, our customers are driving us into. We work so closely with them. Everything we've done has been basically through the relationship with them, which is we need to get on top of this. There's a lot of opportunity in that area. And then really improving visibility and management of drug shortages, something you don't hear about too often, but at any one time, 10% of our drugs our customers use are basically out of stock. and they're constantly having to deal with drug shortages. You might have heard cisplatin or some of these critical cancer drugs. They cost like $40, but when people can't get them, it's a real problem. So there's a lot of problems in the generic drug space that we think we're going to solve in the future.